Welcome back to the Popkin method, where we cut through the noise and give you the real personalized medicine insights that actually work. Today's topic supplements. We're going beyond the Instagram stacks and the aisle at Whole Foods and into the clinical truth. Which supplements actually help and which ones are a waste of money? And how does Dr. Popkin decide what belongs in your care plan? If you've ever stared at a bottle of ashwagandha or B12 and wondered, do I really need this? This episode is for you. I'm excited because I personally know that sounds like me. I'm always looking at all these supplements and never really know if it's right for me. So I'm excited to learn a little bit more about this from you, Dr. Popkin. So let's jump right in. And I know, Dr. Popkin, like I said, I look at supplements all the time and they're everywhere. But most people don't really know where to begin. So, what's the biggest misconception about supplements today?
That's a good question. I think the biggest misconception is that supplements are cure-all for a specific problem. I mean, that's how they're marketed, right? Someone sees an ad or a video and they're touting the next biohacking fix for some common ailment and everyone jumps on it. So, in actuality, a supplement is exactly that. It's a supplement to a comprehensive solution for a specific health issue. The supplement should supplement or complement a structured plan that focuses on lifestyle modification, diet, exercise to address the issue, and the supplement should add to the effectiveness of the program. It should not be a standalone solution. So let me give you an example. I'm a big proponent on having all of my patients gain and maintain as much lean muscle mass as possible. So I recommend creatine and protein primarily to achieve the best results. However, the supplements they're not going to help if you don't modify your lifestyle to include proper sleep, if you don't improve your diet to include more healthy proteins and fats, and decrease starchy carbs. And you certainly won't gain or maintain any lean muscle if you don't do proper resistance exercise to stimulate muscle growth. So the supplements are therefore part of a program and not a standalone solution. And that's what I create in my practice, a care plan, not a supplement solution.
And supplements can be super confusing to those who don't really know much about them and where to start. But do you remember your own early perspective on supplements, either in med school or residency, and how that may have shifted once you started seeing real patients?
Supplements were not taught in medical school and certainly not focused on in residency. Pharmaceuticals were the focus. Again, for me, I always applied a comprehensive approach to solving a problem that starts with lifestyle modification, diet, and exercise. And then came the fix, which was mostly pharmaceutically based during medical school and residency. It wasn't until I started my practice that supplements came into the picture as my independent thought process became more the focus of creating the care plan as opposed to following someone else's plan that was taught in med school or residency. And this was especially important for me, as from the very beginning, I focused on weight loss and wellness to address my patients' health concerns and used pharmaceuticals only after applying lifestyle modification, diet, and exercise to the treatment program.
And when you talk about certain treatment plans and how obviously everyone is different, but how do you decide when a supplement belongs in someone's care plan and when it does not?
So I have a list of 5 core supplements that most people need based on our Americanized lifestyle. And Americanized, what I mean is in the US, we unfortunately are surrounded by ultra processed foods and have a fairly sedentary lifestyle where our unhealthy choices are available anywhere and at any time. It's really not a good thing that you can order fast food or alcohol to be delivered to your house at all hours of the day and night. So, having said that, these core 5 supplements address the most common issues that my patients have, including low energy, decreased muscle mass, systemic inflammation, nutrient and vitamin deficiencies, ingested toxins and microplastics, high stress levels, and poor quality sleep. I think those are the kind of the main things that we're trying to focus on. That's why I like the following 5 core supplements to address these issues. The first one is creatine. I use creatine for increased energy, improved lean muscle mass, and sharper mental focus. I'll expand more on this later in the podcast. The second one is protein powder supplements to ensure that all of my patients get to the goal of 1 gram of protein per pound of ideal body weight to ensure lean muscle maintenance. So if you're 200 pounds and your goal is to be 150 pounds, then you need to consume 150 grams of protein during the course of the day. The third supplement I like to put patients on are pre and probiotics to address gut health issues that are caused by ingested toxins, pesticides, microplastics, and other harmful chemicals that we're exposed to. The fourth one that I think is very important is vitamin D3 K2, as most people have a deficiency in vitamin D3. Of course, I check these levels to look for deficiency, and most of the time I find it. I see deficiencies in vitamin D even here in Florida, where the sun is abundant, and even in my patients that are on supplements they're on vitamin D supplements. Usually these levels are low either due to poor quality supplements or in a lot of cases deficiency in the trace element boron, which is depleted in our soils and it's needed for vitamin D production. The vitamin K2 is essential to make sure that the increased calcium from the vitamin D goes primarily into the bones and not your soft tissues and arteries, which is why vitamin K2 is good for heart health. We want the calcium in your bones. We do not want it in your coronary arteries. The fifth one is magnesium, as most patients are deficient in this essential nutrient that's involved in over 300 key enzymatic processes in the body. I like magnesium glycinate at night, as it also helps with improving sleep quality. You'll want to avoid magnesium oxide as it is very poorly absorbed and primarily causes diarrhea, which is the main ingredient in the milk of magnesia, which is used for constipation. So if you're going to get a supplement for magnesium, do not get magnesium oxide. And I know I talked about the top five that I like to use. You can also make a strong argument for ashwagandha as the sixth one to be on this list, as it helps to decrease elevated cortisol levels from stress, which has numerous negative effects on the body. Elevated cortisol is one of the likely culprits causing endocrine disruption, leading to decreased hormone production in otherwise healthy men and women. And this is where you hear, and this is all over the literature now, that it's been said that men's testosterone levels are half what they used to be compared to just 50 years ago. And I think the prevailing thought is that elevated cortisol, along with other endocrine disruptors, are the main offenders here.
Now, can you give us a real example, maybe someone who's struggling with fatigue or sleep, and walk us through how you'd think through their supplement plan?
Yeah, so you're talking about supplement stacks for specific issues, which are helpful if properly planned and again supported by a comprehensive treatment program. So as I mentioned before, the core five or six supplements that I recommend address most of the issues contributing to fatigue and poor sleep. Of course, these supplements are used in conjunction with a comprehensive care plan, including lifestyle modification, diet, and exercise. So to expand on that a little bit, lifestyle modification includes good sleep hygiene, which is proper wake sleep cycle, an electronic sundown, which means I have my patients turn down or turn off their electronic devices an hour or two before they go to sleep as part of the lifestyle modification to help prepare themselves to sleep. Diet modification to address poor food habits that people have that cause sleep issues. I try to get people to avoid stimulants like caffeine or substances like alcohol prior to bedtime, which will disrupt your sleep. Also, getting proper aerobic and resistance exercise during the day is important to ensure proper calorie consumption. And it also sets up the proper rest and recovery period that sleep provides. So you want to burn off the energy that you accumulate during the day so that you can achieve a restful sleep. And then we can consider other supplements to improve sleep if necessary. Some of the supplements are GABA, L-theanine, and glycine. I try at all costs to not prescribe sleeping pills. In fact, I can't remember the last time I've prescribed anyone a pharmaceutical sleeping pill.
That's really good to know. Just as me personally, I'm someone who I feel like this is targeting me a little in terms of being tired and not having the best sleep hygiene and using, my phone and my device before going to sleep. So those top five and six, including ashwagandha, are something that you would also pretty much recommend overall for someone who is struggling with sleep and those things as well. So that basically those supplements, that stack is able to be used for most people, right?
Yeah, and I think that the main focus here is again for sleep. It's going to be lifestyle modification. It's going to be setting up good sleep hygiene. And I'll tell my patients, I mean, how can you expect your brain to calm down and go into sleep mode when you're stimulating your brain with your phone and constantly giving yourself hits of dopamine every time you're looking on social media. Most people, they go to sleep, they've got their phones up in front of their face, and they wonder why they can't fall asleep. So, put the phones away, turn the lights down, turn the air conditioning down so that the room is cold. Make sure that the room is dark, and by all means, do not, go to sleep, looking at your cell phone if you can avoid it at all.
I know a lot of people do that, and I know some people also, can take up to, let's say, 10 plus supplements a day, hoping for a magic bullet. Now, what's the danger in that, or what's the danger in a DIY supplement stack?
Well, as long as each supplement is thoughtfully chosen, the number of supplements is really not a concern to me as long as they're quality supplements. The more supplements that you take, however, the more likely it is that the supplements are fake, unless you're really going to just a couple of really good trusted sources. And recent studies have shown that as many as 10 to 60% of products that are sold on Amazon could be fake. So that's a pretty high number. Even worse, a test conducted by the US FDA of nearly 70 dietary supplements that were sold online actually revealed that most of them included active ingredients that weren't even listed on the label, meaning you could be taking something that you didn't intend to take. So, again, getting your supplements from a trusted source is really important. And, it's not so much the number of supplements you're taking, it's the number of quality supplements that you're taking. And I generally solve this by using supplements from companies that have proven third party safety and quality standards. I like to use Thorne, Pure Encapsulations, Momentous. I provide my patients with the companies that they should use, so the work's already been done for them, so we can avoid that fake supplement phenomenon. And on top of it, patients are taking supplements that are not real. Then they're not going to get the benefits of it. So they may think, hey, taking this supplement is not fixing my problem, so it's not going to work. When in fact, if you had taken a good quality product, it would work. So that's another reason why we want to make sure that patients are getting good quality supplements.
That's super helpful information. I mean, I'm planning on getting some of these supplements, and my brain automatically went to ordering on Amazon. So that's super valuable information. So thank you for sharing that. I'm sure most people's reaction would probably go to Amazon as well. So that's super helpful to know. But all right, let's play rapid fire. So I'll name a popular supplement and you give your quick take: helpful, harmful, or hyped. So let's start with vitamin D.
I like this game. I've seen this. This is becoming pretty popular in social media, where you'll see people listing off supplements and talking about it. So this will be fun here. Vitamin D. Okay, so vitamin D, fat soluble vitamin, acts more like a hormone than a traditional vitamin. Its benefits, other than the obvious, strengthening your teeth and bones. Vitamin D also, it boosts your immune system. It helps prevent certain types of cancer, helps with brain function, mood disorders, decreases inflammation, decreases oxidative stress. Remember, you want to combine your D3 with vitamin K2 for added cardiovascular benefit. The K2 drives the extra calcium into your bones and away from your coronary arteries where you don't want them. So, vitamin D is definitely helpful.
What about fish oil?
Fish oils. Make sure it's a good quality fish oil that contains the proper ratios of EPA and DHA. And you definitely want to make sure it's free of contaminants like mercury. Again, getting it from a trusted source will help to eliminate that problem. Omega 3s, they support heart health, brain function, they reduce inflammation. Definitely helpful.
What about magnesium?
Okay, so magnesium, definitely one of my favorites here. One of the most useful supplements. Again, depending on the type, I favor magnesium glycinate, magnesium malate, and magnesium threonate. As I said earlier, try to avoid magnesium oxide, as really it does not get absorbed into your body, and primarily it causes the side effect of diarrhea. So you want to avoid magnesium oxide. Also, don't take magnesium supplements that are mixed with calcium because they compete for absorption. So for me, I take 200 milligrams of magnesium glycinate in the morning and the evening to ensure that I get enough. And just because I do that doesn't mean you should do it. This is just what I do. Magnesium is essential for over 300 enzymatic processes in the body that help with bone health, brain health, immunity. It helps to regulate blood pressure, heart rhythm, blood glucose. What else? Magnesium is crucial for muscle function, energy production. It improves glutathione and vitamin D production as well. It's beneficial for sleep, mood, cognitive improvement. The list goes on and on. There have been studies as well regarding magnesium levels in the brains of patients who passed away who had Alzheimer's, and it was found that these patients had much lower levels of magnesium in their brains as compared to those people who did not have Alzheimer's. So magnesium, definitely helpful.
You spoke a little bit about this, but ashwagandha.
Ashwagandha is, again, one of my favorites. It's an adaptogenic herb that has been used for centuries for longevity purposes. Specifically, though, you want to get the KSM 66 root version of this supplement. You'll see it listed on the label. Again, KSM 66 is the what you want to look for. So ashwagandha, its benefits include decreasing cortisol, which will lower stress and anxiety and improve your sleep. By lowering cortisol, it also will support hormone health for both men and women. It also decreases systemic inflammation, supports brain health, so definitely helpful.
And this I've been seeing a lot over social media, so I'm curious to hear your take on this. But NAD plus.
Okay, so NAD plus, definitely a growing trend with claims of anti-aging benefits and improved, you'll hear mitochondrial function leading to improved energy levels. Its effectiveness is still under investigation. I think for mitochondrial health, I would stick to tried and true forms that help to improve mitochondrial function, including methylated forms of B complex vitamins, alpha lipoic acid. You're going to see patients that are either taking NAD plus in its whole vitamin form, which really doesn't get absorbed. It's too large of a molecule to actually be absorbed and get into the cell to actually get to the mitochondria to improve energy function. Most of the time that it's used, it would be more beneficial either in injection form. We're seeing a lot of other type of stacks that you can combine, such as NR and NMN, that you combine with methylating agents that will then help to create NAD plus within the cell. But again, I think it's we don't have enough data to support its benefits. So I'm going to say the supplement is hyped.
Good to know. I have definitely been seeing an uptick on about that on online for sure. So good to know that that's one's hyped. And collagen.
Collagen. Specifically, I use collagen peptides. Collagen is the most abundant protein in our body. It makes up your skin, your hair, your nails, your muscles, the lining of your blood vessels. Supplementation can strengthen your bones, your muscles, help with wrinkles in your face and in your skin. It can speed tissue repair. So I think it's definitely one of the forms of protein that I recommend when we talk about trying to achieve a gram of protein per pound of ideal body weight. So I'm going to say definitely helpful.
Berberine.
Well, you're giving some really good supplements here. So berberine, I think it's fantastic for metabolic and cardiovascular support, and there's plenty of research to back the claims of its effectiveness. It improves insulin sensitivity, so it helps keep blood glucose levels stable, which will then help you lose weight. So it's great for that. Studies suggest that it may help lower LDL, which is your bad cholesterol, and lower your triglycerides, which are your blood fats, and will raise the HDL, which is your good cholesterol. So therefore, it's going to improve your heart health. It's also got anti-inflammatory effects, which adds to its benefits as well. So I'm going to say definitely helpful.
Awesome. So, is there one supplement that's completely underrated that you wish more people knew about or used properly?
Yeah, that's definitely going to be creatine. I've been using creatine in my practice for many years, and it's one of the most studied supplements. And there's some really good research, recent research, to suggest taking higher doses for conditions like sleep deprivation, dementia, low energy syndromes. The dose was always 5 grams per day, and then we started to increase that dosage based on weight by saying if you're 175 pounds or less, you take 5 grams. If you're over 175 pounds, you would take 10 grams per day. But that number is even changing. So right now, though, the dose that we're using is 5 to 10 grams per day for energy production, for lean muscle maintenance, improved cognitive function, regulation of mood disorders. We can add HMB, hydroxymethylbutyrate, to decrease muscle breakdown. Some companies are even combining creatine with HMB. So I think creatine is definitely a must. The way to think about creatine is it's an energy producer. So it's a storage vessel for ATP, which is our the cell's energy currency. So all the tissues of the body will benefit from creatine. It's very well studied. It's safe. It does not cause kidney injury in those that have healthy kidneys, and it does not cause hair loss. So creatine is definitely one of those supplements that I think are underappreciated. Um, I think there's another one I wanted to throw in here as something to consider would be MCT oil. And MCT stands for medium chain triglycerides. The reason I'm mentioning this is, again, it's coming out. People are talking about it on social media. Due to its molecular size being medium chain, you absorb it, but you don't digest it or break it down into its components. So when it gets to the liver converts it into ketone bodies, which the brain uses as energy. So therefore, it's going to boost your metabolism. It'll control your appetite. It'll stabilize blood glucose levels, which again helps with weight loss, decreases inflammation because it's a healthy fat. It helps with tissue repair. And so my recommendation, if you are going to try this, you're going to start with lower doses and titrate up to avoid GI upset. So I would add that to the list of some of the more underappreciated supplements.
I've definitely heard a lot about creatine, but I haven't heard much about MCT oil at all.
You're going to. It's really starting to come out on social media, and again, there's some good science behind it.
Awesome. And now I have a question for you about creatine, just off of things I've heard online as someone who's not super knowledgeable about supplements, but I know creatine is used a lot for pre-workouts and a lot of people that are active take creatine, which makes sense based on what you said regarding energy levels. But I've heard that it could potentially cause weight gain if it's not used properly. Is that true? Or is that a myth?
Well, I think it comes down to the understanding of what creatine actually does in your body. So creatine gets absorbed by the muscles, and it helps to bring water into the cells. So if you're going to be adding, and this is where you want water in your muscle cells. You want your muscle cells to be hydrated. So the more water that your muscles have, the heavier your scale weight is going to be. But that just means you have healthy muscles, and those healthy muscles are going to consume fat better. So you're going to have lower amounts of fat and higher amounts of muscle. So that's why, I try to get patients to understand what the difference is between their scale weight and their actual body composition, which encompasses their lean muscle mass and the amount of fat that they have. So when we do our testing in the office and we're looking at their body fat composition, we'll see that their muscle composition it will go up and their fat composition will go down. Their scale weight may not necessarily change or may actually even go up in some cases, but they're gaining muscle, they're losing fat. So really that accumulation of weight is from the added water that your muscles are absorbing, and that's because you want your muscles to be hydrated. So it really is a good thing.
Got it, that makes sense. I've always wondered about that. I've considered taking creatine. I'm like, "Well, I don't wanna gain weight." So, thank you. I'm sure a lot of people listening might have that question as well.
Yeah, I think everybody, really most people should be on creatine. The only people I would be a little concerned about would be those that have existing kidney disease. So if you have an elevated creatinine level on your blood tests and your kidney function is impaired, if you did go on creatine supplementation, you would want to follow your kidney function on a regular basis. But I think it's beneficial for everybody. It helps. We're seeing it being used a lot in patients who have Alzheimer's because it crosses the blood-brain barrier. It gets energy into the brain. The brain is functioning better. So, years ago, it was just a supplement that was used to make their muscles look bigger. And now it's really being used widespread in longevity medicine.
And I know I'm thinking about getting some supplements after this, and I'm sure a lot of people listening are too. So, what makes a supplement good, and how can someone tell if what they're buying is actually high quality or not?
So what makes a supplement good is if it works for you, right? You want to get it from a reputable source. So you want to make sure that you're getting what you're paying for, first of all. And you want to try it for at least 3 or 4 months before praising or condemning it. So I think that's one of the first things. People will try a supplement, they'll take it for a couple of weeks, they'll take it for a month, they'll get one bottle, they'll take it, may or may not notice anything, and then they'll stop taking it. So I think you want to be consistent with it, and you want to give it some time. So you want to give it a couple of months before you say it works or doesn't work. Then you want to look for third-party certifications. So you want to look for NSF, USP, Consumer Lab certifications of its quality and its purity. I've used many different companies, and I've done the work for my patients when I recommend certain companies over others. I have my patients keep a symptom diary so they can compare how they felt before and after starting a supplement, so we can track their subjective improvements. I try not to start too many supplements at the same time so we know which one is working. And if there's a problem from one of them, we know what it's related to. And then I also look at objective data. I look at blood pressure, I look at weight, I look at body mass index, I look at body fat percentage, and then I also follow certain laboratory biomarkers that'll test for the efficacy of these supplements, including, let's say, pre and post vitamin D levels. So if your vitamin D levels low, we put you on a supplement. We want to make sure that your vitamin D levels are going up. I look at inflammatory markers like HSCRP, which is high sensitivity CRP, which is a marker of inflammation that's specific for cardiac inflammation. I look at ESR, erythrocyte sedimentation rate, which is another marker of inflammation. I look at oxidized LDL, which LDL is your bad cholesterol, and the oxidized form of it is what gets into the arteries and causes issues. I'll look at the omega index to see what your omega 3 compounds are in your body. I look at EPA and DHA levels, and also the omega index looks at omega 3, 6, and 9. So we're looking at all those different levels. EPA and DHA levels, as I mentioned. I'll look at hemoglobin A1C as a marker of insulin sensitivity and in patients with diabetics. I look at LDL, which is bad cholesterol. I look at HDL, which is good cholesterol, triglycerides, which are your blood fats, just to name a few. So we're looking at subjective and objective data to show that your supplements are helping you.
Think it's definitely helpful to go through this with someone who's as knowledgeable as you because I think about these things and I know I would be so overwhelmed and not sure where to start. So it's great that people can reach out to you and have telehealth appointments, whether they're in Florida or not, or actually go and connect with you in person and be able to reach out and connect with you to have an expert guide you through this. I know that's something I think about even now. I'm like, I'm happy I'm getting this information firsthand because I've always been overwhelmed with the thought of supplements, and I know I'm not alone in that. So this is such good information.
Yeah, I appreciate that. And, I think part of what leads to the confusion is social media, which can be a very good thing. But it can also be a bad thing because what happens is, patients get information overload and they don't know what to add or what to take. And depending on the influencer that's talking, or depending on the quality of the video, depending on what the bottle looks like, I mean, there's all sorts of factors that go into why somebody would purchase something. But the main thing that you want to focus on is to see if the product that you're taking is actually making you feel better. That's really the first thing that you have to understand, is that you may take something and it may not work either because it's not a quality supplement, or it may not work because it's not something that your body needs. So again, the idea is that you want your supplement to be put into a treatment program that includes more than just taking the supplement. You want it to include lifestyle modification, diet, and exercise.
Absolutely. And finally, how do you educate your patients to use less but do more, especially when they've been sold supplements by wellness influencers or functional doctors or have been influenced by, like you said, social media?
Well, I try to get people to use what works for you and what you can afford. Again, I try the core five supplements for most patients, the ones that I listed earlier: creatine, protein, pre and probiotics, vitamin D3, K2, and magnesium. And I'll add them in a stepwise fashion so you can see which one is working. If you're getting a side effect from one of them, at least because we're adding them in a stepwise fashion. And then we'll consider other supplements as needed. So, as an example, If you're on the core 5 supplements and you're following a good lifestyle, good diet and exercise modification program, and you need, let's say, hormone modulation, I'll consider for my patients adding ashwagandha if they're not already on it to decrease cortisol, increase free hormone levels. I'll consider boron, which is that trace element that I mentioned that helps to increase vitamin D levels. It also decreases the hormone SHBG, which is sex hormone binding globulin, which holds on to men's testosterone and women's estrogen and progesterone. And if you lower that number, you can increase the free hormone levels and therefore the free effective hormone levels in your body, so that you don't necessarily have to increase the total amount, but you can increase the free amount of those hormone levels to get the benefit. And for the gentleman, I'll also add some products called Tonkat Ali and Phagogia arrestus to increase free testosterone and total testosterone. I'll offer this as an option before considering hormone replacement therapy to see if I can get someone to produce enough of their own hormones so that we can avoid giving them exogenous hormones or injecting hormones into them, or in women using hormone creams and pills and so forth. We want to see if we can improve their symptoms by having their body produce enough of their own hormones. And of course, I also have them do specific lifestyle, diet, and exercise modification to support natural hormone production. So I think the overall message here, though, is whether you're trying to achieve your longevity goals.
So, what is the overall message you want listeners to get out of this podcast and taking supplements?
So the message here is that whatever you're trying to achieve with your longevity goals, always use supplements as part of a comprehensive program that includes lifestyle modification, diet, and exercise to complement each other. Remember, don't just take a supplement. You want to incorporate a supplement program with lifestyle, diet, and exercise modification to get the best results. You want something that's program based, not just purely supplement based.
Absolutely. And like we said earlier, it's not, this magic bullet. It's not just taking a supplement stack is going to solve everything. It needs to be, like you said, incorporated into a plan and a program. And it's a supplement, literally supplementing your lifestyle and the program and overall lifestyle, a healthy lifestyle change.
Correct.
And talking about supplements and how they supplement your lifestyle and work in addition to any program or lifestyle change, they should be used as powerful tools and not expensive guesses. So, when they're chosen the right way, especially by a doctor who blends internal medicine and integrative care, they can make a huge difference in energy, sleep, recovery, and long term health. So if this episode helped you rethink your supplements shelf, I know it made me rethink mine. Share it with a friend. And also, if you are ready for a real care plan, not just random pills and supplements, visit thepopkinmethod.com and feel free to message Dr. Popkin directly for anything supplement or longevity related. He'll definitely be happy to help you out. And you can also actually request a telehealth consult to review this with him and review your current supplement regimen and see how the Popkin method can help improve your specific health and happiness. This is the Popkin method. Thanks and see you next time.